This adjustment is a supine bimanual grasp proximal tibia with knee stabilization for an internal and external mobilization of the tibiofemoral joint. In this adjustment here, we'll use that same distal tib-fib contact between our legs. And then Doc, what I'm going to have you do is you'll put your thumbs on either side of the tibial tuberosity here. Now, our goal in doing this mobilization is I want to establish or reestablish internal-external rotation. And so in doing this, what I'll do is I'm going to bend the knee, and in this instance I will externally rotate and drop that knee down. And then I'll come back to middle, internally rotate here. Now I'm going to keep doing this M pattern that we've done here. So external rotation, neutral, internal rotation. And I'm going to keep replicating this M pattern, inducing that little bit of a rotation externally and internally of that knee. Now this does two things. If there's a restriction, either an external or internal rotation, this will help build and mobilize in that that external or internal rotation that is lacking. Additionally, if we have a meniscal tear or a meniscal lesion, using this style of an adjustment, maybe my patient is completely unable to have any sort of a long axis distraction. Now we did give you an option that can reduce some of the force that's applied through the hip in those long axis style of adjustments, but it'll never get rid of all of the force completely. Having an adjustment like this does get rid of the vast majority of the force that is placed through the hip, and so we can influence a meniscal tear that might be present by using this this force with an external rotation and then an internal rotation as well, just trying to get that meniscus to either lie flat again if it's flipped itself back up, or if we have maybe a floating fragment in that joint that we're trying to move out, we can use this as a gentle way to kind of motivate it out of the way. Again, this adjustment was a supine bimanual grasp, proximal tibia with knee stabilization for internal and external mobilization of the tibiofemoral joint.